good evening. Good evening, everyone.
I'm a Superman and thanks to Lois Lane. It's the way my brother from the dance when I lost my name. Ooh, something I'm looking for.
Okay. Hey, I'm back.
Okay, hi. I've
Hi.
started over again. I just thought, okay, let me just start over.
Oh, okay.
It's not
That's
that
fine.
different. How was your week?
It was good. It was good. I was actually having to test waters in the sense that I got myself into a boot camp, something that I've never done in my entire life, basically, as an adult. So I got into the boot camp, and I happened to learn quite a few things in terms of making money and making money through trades. So that's something that I got to learn over the week. So it was very good. It was a 5-day boot camp, and yeah, I learned quite a number of things, and I'm still yet to learn more. Learning is a process. So yeah,
Yeah.
and your side.
Been very productive, very
Nice.
busy, and I've been working very hard. And yeah, I'm just praying and hoping that the hard work pays off. So yeah, that's how it's been
Sweet.
for me. And I'm glad that you've done something
Okay.
new, and tried something new, and that
Yeah.
you will actually learn more about it and you'll expand on it and get really good at it. Hi, Jamma.
Absolutely. Yes.
How are you? How are you? Thanks for joining us. So yeah, today we're
Oh,
going to
hi,
be
Gemma and Ice Queen
Ice Cream
B.
Bee.
I see Ice Queen
Okay.
B.
Yes, hi,
Thank you
good
so
evening.
much,
Thanks for
guys.
joining us. So today, I wanted to talk about the fibroids and the thyroid, because it's a lot of things that women actually suffer with in silence, and
Yeah.
it affects a lot of us. There's a lot of pain that comes with having fibroids. Years ago, whilst I was carrying my fourth child, I was told, they did the scan, and they told me that I had a few small fibroids. So I was like, what?
Yeah.
Um, so I didn't have any because I had a child, the third one, a year before, and it wasn't picked up at all. So I was kind of surprised how quickly that they must have grown. I don't know if it was to do with hormones or what, I'm not sure, but they were there with the fourth child, which was only like a year later. But I do
Okay.
have a history of it in my family with fibroids. My mother has it, my aunts have it. So it's something that I'm really interested in. And I know a lot of women that have had to go through operations to actually remove their fibroids, and they grew really, really big.
Yeah.
So, hi, Jamma. So it's
Hi,
something
Gemma. Yeah.
um, I really want to get more information and to find out how we can go about avoiding them if you've not got them, but also how to treat them, because I heard that they can be shrunk. So what can we do to actually shrink them? I didn't really put endometriosis, but that's something else that they kind of touched on and said, oh, you've got a little bit of that. And I was like, well, when did that happen? So I don't know if that's something that's connected to it, and if we can
Yeah.
speak about that also. And with the thyroid, is something that my mother actually had. So they've watched me at the hospital. I've had to go to do checks to actually check
Yeah.
my thyroid. So that would be nice to know if there's any natural solutions or natural ways that we can actually treat those problems and issues that a lot of women have. And I know if I'm going to speak to anyone about it, I'll speak to you about it. because I know that when it comes to natural dealing with things and healing things naturally, there's no other person I would speak to except for you. So,
All
should we
right.
start? Should we start with the fibroids first?
Okay. Yes. Thank you for having me once again, and thank you for the viewers as well, making their time just to, tune in on this call. So, right, fibroids basically, these are non-cancerous growths or tumors, right? That actually grow on the muscle area in the uterus, right? So that can actually develop during a woman's childbearing period or childbearing years, right? So the size of a fibroid can actually grow to a size of a watermelon, to a point that a woman, when you look at her, she'll look like someone who's pregnant, yet that person is not pregnant. So
Yeah,
in most cases, when you see ladies having a big pooch, I don't want to say big stomach because some people get offended when you say big stomach.
yeah,
So when you
yeah.
see a big pooch, sometimes we know that people will quick to say, oh, that person eats a lot. Oh, that person is, so there's contributing factors. Before you can actually start labeling people, you need to first maybe have a polite way of approaching the person and asking them a question to say,
Yes, yes.
are they still in the childbearing years? If they are, or are they not? And if they are, then just kindly ask them how often do they go to do what is called pap smear. Some women, they don't know what pap smear is. Like you tell them what PEPs or ask about pap smear, they just buckled up. Like they don't know what that means.
That
So
is
yeah,
that's very, very important, and maybe something we can talk about. But the pap smear, they tell women you need to go and take that pap smear. It is very, very, very important for women to take it. And there are women that don't take it and they later found out eventually that they've got cervix cancer. I myself have had changes in my cervix before and stuff like that. So I'm talking from personal experience as well. It's very, very important for women to make sure that they go and take their pap smear. But we can
yes.
talk about that next time.
And thank you ever so much for sharing your story, because a lot of people they not brave enough to come out in in public space or like on this platform basically to like really talk about such experiences in life. So as I was still saying that, so with fibroids, you tend to ignore and assume that maybe it's because of your eating habits, that you think maybe that's why you're having a big pooch. Sometimes even it affects your period flow as well. So there's a whole lot of things that we need to look at when we speak of fibroids. We can speak of infertility issues. We can speak of also tubal blockage, because your tubes get blocked in the process as well.
Yes,
Right?
yes,
Yes.
yes.
So all these things, we need to actually look at it and say, how best can we deal with this? And another thing, guys, when we go for pap smear, like I always tell people, we don't say to people, don't go to your doctors or anything, but there's always going to be a natural way that can actually treat or prevent you having to succumb to fibroids. So what are we talking about basically here? So we can actually melt a fibroid. So by simply melting a fibroid, one is probably thinking, what are you, okay, I understand you're talking about melting a fibroid, but what is the process involved there? So basically, so we've got a product, and this product has helped so many women. I've lost count of women that have come to me and I've helped them in terms of fibroids. It's a product which we call uterus cleansing pill. It's a detoxing pill. It's a vaginal and a uterus detoxing pill. So the pill, basically, you actually imbibed it 7 centimeters deep into your private part, right? It stays there for not more than 72 hours. So before we actually use the pill, we need to make note that the pill is not used by pregnant women. It is not used by virgins. It's also not used during your menstruation, right? So those three things, we need to take note of that. And I strongly condone people that also sell this particular product to people that want to abort. Because there's people that would not want to fall pregnant, and or somehow they find themselves they're pregnant and they don't want to have that child. And this pill can cause one to also have a miscarriage. So we strongly advise women that I do not sell it to women that want to remove a child, because that is life. We are only here to edify life, not to take life away. So we do not we condone if ever there's people that do that. But there's always legal methods that you could take, which is going to the hospital, etc., right? So that is the product that I touched on. And before we go even deeper, we need to also look into what people should eat to actually avoid.
That's what I was going to ask you. Yeah.
Yes. So the foods that one needs to eat, basically, you need to eat lots of green leafy vegetables, right? You also need to eat high fiber foods. So which high fiber foods are we talking about here? We're talking about things like broccoli, right? And that falls under vegetables, basically, right? We're talking also things like your foods that are also rich in beta carotene, which is your carrots, your sweet potatoes, right? Then we also need to take foods that are also rich in iron. Which foods are these? We're talking of flax seeds, we're talking of whole grain, we're talking of citrus fruits, which is apples and oranges, right? So those are the foods that we need to actually eat in order for us to maintain or manage our womb side of things, not having to succumb to the fibroid side of things, because all this happens through food, guys. And the other thing that I also want to touch on is usually when ladies go through their menstruation cycle, there's always going to be toxins that are going to remain behind. So in most cases, when you go through your menstruation cycle, you are not actually taking all the toxins out. So that part of the toxins that remains inside will build up, right? So that's going to build up, and that's more toxins building up, such as, like, blocking your tubes, right? And also old blood will start clotting in your uterus, which is what then also causes the fibroid. So yes. So now when that happens, we also say to people, like, we can't actually nature an ailment or a condition to a point that when you come to us, then we start saying, oh, you're too late, or when you go to the hospital. Because, guys, you need to understand that an operation is not cure. So you spoke about having an operation. An operation is not cure in the sense that you are just going to get cut. They open you up. They cut where the fibroid is, right? When they cut where the fibroid is.
Thanks, Jammer. Sorry. Thanks, Jammer, for joining. He said he has to go. Thank you. And please do share. Okay. And welcome 5770.
Right. So when they open you up and when they cut the fibroid, most people think that is cure. That's not cure. They're only cutting where the fibroid. Remember, this is a non-cancerous tumor or growth. So it will grow elsewhere within your uterus as well. So imagine how many times you're going to keep on getting yourself opened up, getting cut, to a point that they'll end up removing your uterus. Yeah. So you'll not have a womb in the end result. And I mean, if you are in the childbearing years, that's a disaster, because you're going to get married and your husband, or like where we from in the Black society, if you can't give kids, it's another story. So
Yeah, but
I think there's no woman. Yeah,
I
there's
do know a
no.
few people that have had issues because of having fibroids in terms of fertility and having children. And that's another reason why it's not nice if someone looks at a person and says, "Oh, you've got the bulge. Oh, are you pregnant or are you fat or something's happening?" People really
Exactly.
need to be careful what they say because they don't really know what a woman might be going through, and that's
Exactly.
something that can affect them. But when I found out you're talking about foods, I noticed that if I have a lot of sugary stuff
Uh-huh.
or certain things in my diet, I can really feel it like a burning sensation
Mm.
on my right lower side. I can feel it actually. So I try to keep away from certain things because
Yeah,
apparently you can feed them. It's like you're feeding them when you have sugary stuff and other things as
exactly.
well. So I understand what you're saying in terms of watching your diet and eating certain things
Yes.
to try and prevent them from happening in the first place because it can only grow back. And they do say if they remove them, because a few friends I know that have had the operations, they've told them that they can actually grow back. So that confirms what you're saying about they're just removing them and they can grow somewhere else.
Exactly. So with that product that I mentioned, the uterus cleansing pill, that product will melt the fibroid and it will actually detox your womb through the vaginal canal, and you're not going to succumb to any issues of infertility, blocked fallopian tubes, premenstrual syndrome, because there's quite a number of people that succumb to premenstrual syndrome to a point that some people miss work. If it's teenagers, they miss school because of that, right? So
Yeah.
that product will actually help in that regard. So, but we still have a number of other products that we can mention. We also have a product called Soy Power, right? Soy Power capsules. So Soy Power capsules, this is a product that actually takes care of your ovaries, and it actually balances. It's responsible. It helps to maintain um, the hormone of females, right? So
Okay.
you're basically going to maintain the hormone, because if your hormone is not balanced, then there's
Hmm.
going to be issues again. And if your estrogen side of things is not also balanced, it also leads to a woman losing shape. So most of the women that we see that have lost shape, like in the sense that maybe they've got something hanging out from the arms, or their body is no longer structured in a way that you'd say, oh, that's a woman, you know. It's because of
Okay.
your estrogen side of your estrogen levels have actually dropped or non-existent. So we need to make sure that also your estrogen side is also maintained. You need to avoid gluten foods. So those are the foods that you need to avoid. You need to avoid gluten foods, things like the chocolates. It's about you having to eat
Okay, you're
sweet
back.
things, right? So avoid eating chocolates, cake, right? It's also not okay. White bread, rice, pasta, all those things, they contribute to one having to succumb to fibroids, right? And
Oh, goodness.
now, and,
Chocolate. It's
yeah,
funny, Brian, because I know a lot of women, especially myself, when it's that time and you're coming on your menstruation, your period, you actually feel to have sweet stuff. You want to have a bit of chocolate. So, but that's exactly
yeah,
what we should not be eating. So
yes,
it kind of it's hard, but I guess with discipline and knowledge and us
yeah,
trying to prevent certain things from happening,
ab-
we just have to just, try to change up our diet.
absolutely, yes. So it's all about changing your diet, and things will fall into place. And also, we need to also make sure that we take lots of foods that are also excess fiber. You need excess fiber. We spoke about what foods to eat. So excess fiber is very, very rich. It's needed in order for you to actually avoid to succumb to fibers. But we also, like said, we've got supplements. So I've already spoken about two supplements here. Spoken about the uterus cleansing pill and the soy power. Now, the other product that we need to take also is what is called royal jelly. Royal jelly. So royal jelly, this product is good in actually inhibiting any toxins within your womb or your uterus, as well as the entire rest of your body, basically. So that product, you need to take it. And also for the ladies, that royal jelly, it balances the pH balance of your discharge. So you're not going to have an abnormal discharge or excessive discharge, which is going to be smelly, and you don't want people asking you, are you a fishmonger, and all those kind of things. I know it might sound harsh to some people, but you don't want to be somebody asking you that, right? So royal jelly is very, very good for that. It actually balances your pH balance of your discharge. So your discharge is always going to be normal. I know some women, they think having a discharge is abnormal. A discharge, guys, your vagina is actually designed to cleanse itself, not heal itself. So most people, most women, they think the vagina heals itself. So when your vagina excretes that discharge, it's actually cleansing itself, right? But it's not healing itself. So you need to take that royal jelly in order for you to also help your vagina to actually heal, because there's a whole lot of toxins that happen there. People, they wear different types of underwear, and that is a contributing factor as well. When you wear under, like, I think lace, if you put on too many, like if you wear lots of lace underwear, it's okay to wear your lace underwear, right? But it shouldn't be all the time. That's why we always advise people to wear cotton. So that also will help you.
It's the same as wearing the pads as well. You need to be careful which type of pads you use, because the chemicals that they put in there, and if they're not cotton, those chemicals can also lead to other problems. They've said stuff like cervix cancer.
In actual fact, now
we
also have the pads as well. We also have organic pads that actually will help also women of all walks of life in terms of things like your PMSs and your endometriosis that we spoke about, right? So it will actually also help in that. It will actually root out. Remember, we are rooting out the cause, not the symptom. Hospitals will only deal with the symptom, not the cause. But with these supplements, you are actually dealing with the root cause, and it will go permanently. So we're not going to nurture a disease or an ailment. We are rooting it out straight away from the core, and it's done, right? So then moving forth, we also have another product which we call propolis. Propolis, right? So propolis is good for attending to bacterial, and it's an antivirus product. So you find that there's issues of bacteria, there's issues of microorganisms that happen in that area where you might get infections, right? Now, which infections are we talking about? We're talking of things like STI and UTI, right? So fibroids is just the main thing we talk, but we need to also break it down so that people understand, because all these things, they trigger to fibroids.
Yeah, they don't really talk about that, but yes.
Yes, right. So when you take your propolis, you are actually blocking things like infections, which is the UTI, the STI, right? So UTI, this is where we're talking about the urinary tract infection. And I know with most women, or let me put it in general and say, people always assume, especially when it's UTI, that it could be maybe the woman is being promiscuous, has been sleeping around with other men. No, right? Because women, they use the latrine and they sit on the toilet seat. And men, we mess it up in the sense that when we come to the toilet, to the restroom, we stand there and
don't even go there.
We misfire, right? So we misfire and we leave stains there. Or we might wipe, but we're not wiping with sanitizers, right? Then your better half comes and sits there and they do their business and they walk out. And again, whilst we're on there, it's how you wipe yourself as a lady. You need to wipe yourself going backwards, not upwards. So when you wipe yourself going upwards, what you're simply doing is you're taking all the bacteria, which is there to the most sensitive part of your vagina, right? And a whole lot of things start happening there, right? Then we also now talk about the STI, which is the sexually transmitted infections. So the sexually transmitted infections, we need to actually deal with that. What are we talking about? We've got HPV. You find that in most cases with the women, they've got these little tiny white dots that are on the walls of the vagina. Then on the male side, they pop up on the head of the penis, right? So we need to take note of that these things can be treated, right? So on the STI side of things, we've got a product which is called Ganoderma. Ganoderma is a very strong antioxidant product. It fights infections aggressively. So even for people that undergo chemotherapy, whether you've gone under what you call cervical cancer issues, you can still take that product, right? Then we also have what is called kidney tonifying for women. Ladies, your kidneys are very fundamental, because if your kidneys are not functioning properly, you often hear women talk of pelvic pain. During intercourse with your partner, your sexual lifestyle basically is going to be excruciating, because you are just going to experience pain whenever you indulge with your partner. It's because of that issue that I spoke about. So we need to make sure that we need to take your kidney tonifying. And also by so taking your kidney tonifying, it enhances your sexual side of things. So you're always going to have a good encounter when you actually with your partner, when you indulge in your sex life, right, with your partner. So that's on the fibroid side. That's a wrap on that.
Yes.
So
yeah,
because I also want to,
you.
if people need to know more, they can always, my email account is on my handle, or they can simply DM me as well if they need further more information about the fibroid side, right? So now moving forward, we need
Let
to
me
also
just
now
say
talk
hello.
about...
We've got Duckster 33 here, and we've got Jeremiah. Good evening, and thanks for joining us. So yeah, we just spoke about fibroids and how to prevent them, if we have them, how to treat them. We just discussed some natural products as well, because we're trying to look at the natural way to actually treat and prevent fibroids, and not just looking at the Western way in terms of using just having an operation.
And it saves money as well. It saves money because imagine having to undergo an operation, you pay lump sums of money. And whereas with the conventional methods, you save a lot of money, but the process is very effective and it deals with the root cause. And just also to touch on as well on this, these supplements I've spoken about, they are not only used by people who are sufferers, but also people we intend to prevent. So if you are a lady, you need to take care of your womb. You need to take care of your uterus. Don't wait for you to get sick, then you start running for these supplements. You need to take these supplements because this is not medicine. It's a herb. It means a supplement, in simple terms, it means adding something that is insufficient to the body. So we are adding what is insufficient to the body. You might not be having enough iron in your body. You might not be having enough of your calcium in your body. So by taking these supplements, you are actually adding what is insufficient to your body. So if you are a sufferer, it will give treatment. If you are not a sufferer, it will prevent you from succumbing to those issues.
Brilliant. Thank you. Thank you very much. So what about the thyroid? Hi, Crazy. Right. Thanks for joining us, Crazy. So how can we deal with how can we deal with the thyroid now?
Okay.
Because
So,
we hear less about the thyroid even compared to the fibroids. So how do we
right,
deal with that?
right. So when we thyroid, first things first, we need to know what thyroid is, right?